Welcome to today's talk. The basic idea I want to talk to you today about was about Kent, and especially today's talk is for the beginners, for people who want to start studying Kent repertory, people who want to actually start studying repertory. How to start is by Kent, and Kent is the main repertory by which you have to start studying. It's like A B C D E F G for homeopathy and for repertory. Understanding repertory and using repertory artistically can increase your materia medica skills. I often use repertory to understand materia medica a little bit more. It opens up your idea even more about remedies. So this is a short attempt to give you an idea a little bit about, especially for the beginners, how do I start studying? So Kent, basically you have to understand, was very influenced by Swedenborg concept, and he worked with this psychologist for some time, and he then realized building drug pictures of remedies. Kent repertory is often built on strong mind and generals. There are many detailed symptoms. Delusion, dreams, delirium, all this is very strong in Kent. Craving, aversion are also very strong. It's especially very important. With the help of Kent, you can find a constitutional remedy. Well, Kent repertory was built on a lot of sources. One of the sources was Morninghausen, but strongly Lippi. Lippi, Materia Medica, and even Lippi's cough. There was a repertory. Bell's diarrhea, Guernsey's writing, Herring's writing, Jar's writing. So he collected all this. Every repertory has a source. Kent has given all this as a source. But what I want to talk to you mainly in depth today was about how to use different chapters of Kent. This is the most important thing. Because only then you will actually realize how to use repertory, by how, when the patient says something, how to convert it. So one should know the different chapters in Kent: mind, vertigo, head pain, eye, vision, ear, hearing, nose, face, mouth, teeth, throat, external throat, stomach. Remember, there is no neck in homeopathy, there is external throat, stomach, abdomen, rectum, stool, bladder, kidney, prostate, urethra, urine, male genitals, female genital, larynx, respiration, cough, expectoration, chest, back, extremities, extremity pain, sleep. The dreams are there in the sleep chapter in Kent. Chill, fever, sweat, skin, and generalities. So there are all these chapters in Kent, roughly around 37 chapters. But the most important thing I want to talk to you today about is how to find the rubric. When patient says something, how to find the exact rubric. I would like to write here exact. Exact. What patient says, how to find it exactly. So there is a step to do it, and I will try to help you how I do it, how I learned from the masters to do it, and how I have developed a technique on converting patient's language into exact rubrics. And this is the entire technique which I want to share with you, my friends. And generally, there are 5 steps of converting patient language into rubric. The first step is to understand. So, to explain this, I'll try to give you one of my case examples. I was treating a patient of cough, and one homeopath had given him antim-tart. So, I asked the patient, "Tell me what happens when you cough." He says, "Whenever I cough, there is a lot of smell that comes from my mouth." I said, "Is it smell? What happens when you say smell? What do you mean?" "A lot of smell." So the first step to convert the rubric is first understand what is this. That when he's coughing, there is smell from mouth. It's interesting. What is the key word here? Which are the important words in patient's language? Cough, smell, mouth. Which repertory you have to use? Should I use Kent? Should I use Complete? Should I use Fatak? Should I use BBCR? Then once I decide its repertory, for example, now by default we are going to take Kent. Which chapter will I see? So should I see it in mouth? Should I see it in cough? And then we have to go inside that chapter, for example, mouth, and study all the rubrics of mouth and find the close rubrics. Two, three, you'll find two, three rubrics which are similar. And then out of which you have to find that exact rubric that matches exact. So in this case, you'll find that in the mouth, odor, offensive, cough during. The remedy I gave him was capsicum. This is a key feature of capsicum. Next time, whenever a patient is coughing, just go and smell. You'll see, smell, give capsicum. So this is what I want you to learn. Learn this step-by-step method to convert patient language to rubric. This is the treasure. This is another case. This is a case of a child. He had come from Nepal to see me, and what he would have was he would try to say meh, meh, meh. He would take a lot of time to speak one word. So the rubric for him was speech difficult, words can utter single with great exertion. Another way it is given, speech stammering, exert long time before he can utter a word. See, stramonium. And I want to tell you, stramonium tenem. And he was set right. This is the power of our medicines. Another patient who had come to see me, he had come from Belgaum. He would say, my memory is okay, but whenever I speak, my words upar niche ho jata. They are up and down. I say Kulkarni, I have to say Klurni. If I have to say Patel, it is Fatel. So you have to open speech difficult. Names cannot pronounce. China self. Remarkable. Remarkable. The repertory will open up. So the idea is once I get China self, I don't prescribe China self. Then I have to study in the case, are there elements of China and self in the case? One patient would say, doctor, whenever I eat bread, lot of bread, burger, then my mouth becomes dry. You can see mouth taste dry, bread taste. The remedy was thuja. Another patient, a lady, she came and told me that she has developed fever. I said, what is the symptom in fever? So you have to go in depth. Fever, there is no remedy for fever in homeopathy. What happens in fever? How it starts? What was the effect of that on you? How it started? My in-laws insulted me. What was the feeling? I felt hurt. So when someone says hurt, doesn't mean staphylococcus. You have to ask what is the effect of hurt on you. I said when he hurt me, my mouth, it became very bitter. That was the first symptom. So now this is the way you have to elicit the peculiarities. Bitter taste in the mouth from insult or mortification. देखिए, mouth taste bitter, mortification after. This is considered. This is how you have to pick up remedies. Go in depth. This is the idea of exact and depth. Another patient came and told me, doctor, whenever I'm eating, I feel my teeth are very loose, as if they will fall down. Okay. Looseness sensation when masticating, hyoscyamus. This is what I gave. So I'm just going a little faster and giving you more ideas. So my idea is when I'm teaching you this, you open Kent and you try to find on your own. So when I speak, you pause it and open Kent and then you try to do. This is the way I learned with Dr. Sankaran, with Dr. Sarkar, with Dr. M.M. Dotta, with Dr. Vijay Vaishnav. All these masters, I have to sit with them for years. I have to sit in the feet and learn. Another patient, he would say, I get toothache. I said, okay. So what you do? He said, I have to take my collar like this and bite it, then I feel better. This case took me half an hour to solve. See this. Pain, toothache, biting on elastic substance ameliorate. देखिए, manganum. Another patient, he said, then doctor, whenever I get stressed, whenever I get tense, there is a tightness here in the throat too. And when I eat, I feel better. So very nicely constriction in throat pit, eating amenorrhea, देखो Rustox. You will never imagine Rustox like this. But here, Rustox feels tight, stiff. He will say, I feel stiff in the joint, I feel stiff here. This is the stiffness, this is the sensation of Rustox anacardiasis. This was a very interesting case. This lady would tell me, whenever I get dysmenorrhea, before the menses, I have lot of craving to have wine and alcohol. And you won't believe, she improved with what? Stomach desire, alcohol, menses before. Selenium. Can you imagine? Selenium is a male remedy, but remarkably it helped in dysmenorrhea. This is homeopathy. Individualize the case. One another patient. So I am giving you short case example just to teach you how to convert patient's language. Say, doctor, I don't feel hungry at night, but when I see others eating, I feel more and more and more hungry, and then I eat more. Appetite, ravenous, eating increases the hunger. Ravenous means small eating. Another doctor, when I go out to dinner, I feel hungry, but first bite and then I don't feel like eating. Silica. Appetite increase vanishing on attempting to eat. This is the difference between Lyco and Silica. Lyco, once he eats, he wants to eat more. Silica, once he eats, wants to eat less. Interesting. Doctor, little pani puri I ate, diarrhea. Little bhel puri, diarrhea. Diarrhea, indiscretion in eating. Like a pulsatilla is very important remedy. Doctor, even after I pass urine, I feel something is remaining. कुछ बाकी है, कुछ बाकी है. Bladder urination satisfactory. Feel as if urine remained. This is a very important symptom of thuja. Doctor, whenever I'm with my friends, my throat gets hoarse, and it starts because we keep on laughing, we keep on joking. More I laugh, my throat gets bad. Okay, voice hoarseness when laughing. Calcarea flow. Doctor, I get throat become hoarse, but when I talk, then my throat gets better. Voice hoarseness, talking improves after. Rustox. Rustox everything. Huh? This patient was interesting. He used to get ulcers. I said, how did the ulcers start? So whenever there is ulcers, pain in the feet, there is ulcer, diabetic ulcer. But whenever that is more, my breathlessness increases. It took me 1 hour to find this rubric. But the remedy was pulsatilla, you can see. Respiration difficult disease condition of distant parts not involved in act of breathing. Child of bronchitis. Mother says, he doesn't cough at all. I said, how is it possible? He said, because he's scared of coughing. If he coughs, there will be a lot of pain. So he's very scared. He doesn't cough only. Okay, fear of cough. To avoid it as much as possible, phosphorus. You have to understand the psychology. Homeopathy is deep analysis. So whenever I cough, I have to hold this or this will cut up. देखिए एलियम सीखा. Grasping of larynx because this will break. I keep coughing again and again and again because if I cough, I feel my stomach will open up and there will be pain here. So then I have to hold my stomach. Cough, hands holding pit amenorrhea. Like Drosera, they have to hold their stomach. So this is my small attempt to show you how to convert patient's language into rubric. This is what I want to actually tell you more and more. Today morning I saw this case who would tell me, doctor, whenever I hold my phone like this, just where I hold, here I get sweat. Just in this area I get sweat. Wherever I'm holding I get sweat. So देखिए, you can open, I'm going to open a bigger repertory. You can open perspiration and then parts, lane on. Can you see that? This is a very important symptom for sanicula nitric acid in China. I gave sanicula with remarkable precision. So this is the way you have to convert. So this is just a general idea I wanted to give you. This is something that I believe in a lot. That the genius is within you. It's not outside. It is the genius within you comes up when you're alone. Your best ideas come when you're alone. Be alone. Be a fighter. Be detached from the world. Focus at your ambition. What you want. Go for it. One can do it. Homeopathy is a fantastic science. So you can write to me. You can watch more of my videos. If you want to discuss some case with me, my Skype ID is there. You can write to me. Once you do this, then you start studying the mind rubrics and you write back to me what you felt.